is William, hopefully your favorite videographer from Two Hats Publishing. I welcome you to Move On, Speaker of the Month at La Madeline's Restaurant, 3906 Lemon Avenue, Dallas, Texas. It's 1 block north of Oak Lawn and Lemon Avenue on the east side of Lemon. When visiting La Madeline's Restaurant, tell them you want to make a reservation for the next Move On Speaker of the Month.
Good afternoon, everybody. Thank y'all so much for bearing the weather to come out today, even if you had to come out, because you are the husband or the father of somebody. I'll start off by giving a little bit of background about who I am. My name is Brianna Brown. I work with the Texas Organizing Project. That's not background about who I am. I am a daughter of the state of Texas, right? I've been born and raised here. I born in Houston, grew up in Lubbock, Texas. I know, right?
I lived in Lubbock.
Oh, you did? Yeah, those were my formative years. And then eventually graduated high school from Duncanville High School. Our women's basketball team almost went 106-0, but lost last night in the championship. Can't win them all, but very proud of those roots. I spent some time away. I went to college in Rhode Island. I worked in New York for some time, working in things that I thought were just really fun and frivolous, like fashion and film. And then I got a lot more serious whenever I moved back to Texas. I've worked at a congressperson's office, and then for a re-election campaign, President Obama's re-election campaign in Ohio. And then now I work with the Texas Organizing Project. And the Texas Organizing Project is a grassroots organization. It was started back in 2009, kind of filling a gap that exists here in Texas in a lot of ways. We are, bread and butter community organizers, which is very much, we're standing on the shoulders of folks like Nelson Mandela. He was a community organizer in the highest regard. President Obama, part of his biography that often gets ridiculed is his experience as a community organizer. But essentially what that means is that we're very interested in folks who are on the margins and bringing those folks into the margins. So typically, before we take on these issue campaigns, we organize around really local issues. So if there's a failing school, if folks need a stoplight in their neighborhoods, a bus stop in their neighborhoods that it's not there, then we go into those neighborhoods and help them access whatever resources, with the hope that eventually they won't need us, right? That if some issue like that comes up, we become more of a support mechanism. But just recently we've taken on these issue campaigns. We have one involving immigration, so we're fighting for comprehensive immigration reform. Y'all might have seen us, we get lots of publicity about that campaign because we've been pretty aggressive in the things that we've done. Just recently we went to Senator Cruz's office with a bag of bologna, or some bologna and some bread, and saying that our families, Texas families, our undocumented families deserve better than bologna. We do things like that a lot. We're not at all afraid of agitating the system. In fact, we really want to turn the system on its head. And then also we have this big healthcare campaign. We've been working on healthcare for the past year and a half, using really kind of bread and butter organizing tools to get the word out about the Affordable Care Act. So we start from this fundamental premise that access to good quality healthcare is a basic human right. And we kind of build on that by saying that all Texans deserve access to good quality healthcare, right? And then, so we have tried to figure out, what does that mean for us? As I was kind of explaining a little earlier, so we are a completely member-driven organization. So the reason why we work on immigration, or we're trying to stop the school to prison pipeline, or we've undertaken this healthcare campaign, is because our members don't have healthcare, because our members are undocumented, because our members have children that are in that school to prison pipeline. And doing so allows us that kind of autonomy to really fight, to do those things like practice civil disobedience, which we have members and staff who get arrested, who've gone down to DC just recently and were arrested. It really allows us to be true to that mold that I was talking about a little bit earlier, standing on the shoulders of folks like Nelson Mandela. So the healthcare, are there any questions about that? I'm trying to like get big picture about who we are, the Texas Organizing Project. Any questions about me, I suppose, at this point?
The organization, where does it go to funding?
So we're funded by members. I can't remember like the exact pie chart, but we work very much like a church or a union that way. We get grant support from different grants, and then we also are supported by some labor unions.
Okay.
Yeah.
And how many paid staff?
In Texas, in Dallas, there are 10.
Oh, good.
Across the state, so we have offices down in the Valley, in San Antonio, and in Houston, and Dallas. So we had a big staff meeting in February. There were 40 people altogether. 40. Everyone's on an organizer, right? A lot of folks are. So we have like an office manager and support staff. Yeah, yeah. We really and it looks like it's going to be growing too because at that staff meeting, funny to say. Speaking of the staff meeting, I guess Winnie Davis came to the staff meeting. She was in the neighborhood. We are a nonpartisan organization. I should say that because we are a nonprofit. We do have a PAC that allows us to get really political, and you'll see that, and you'll kind of hear that in the course of this presentation. And that was important for us, for instance, because she made commitments that if she were to become governor, that she would expand Medicaid, which is one of the big principles that we're fighting for now. One of the big campaigns that we're fighting for now. We kind of make the same. We extend invitations to all sides, really, and we don't always hear back from all sides. So, so we have a nonprofit arm, and then we have I can't always remember a PAC, but there's like 3C and then a 4C. We have both of those that are kind of C4. Thank you. It's alphabet soup sometimes. So that's the big picture of like who the Texas Organizing Project is, right? And then I was going to get into a little bit about the campaign, our healthcare campaign. No questions. And in the spirit of community organizing, and especially in groups like this, I like to know everyone's name. I know some folks' name who were here, but if we can just go around, because ideally I'd like to make this conversation really interactive too, so if folks have questions and while I'm speaking, please feel free. So we'll just start over here. So if you could tell us your name, and I don't know, let's see what a good icebreaker question might be. Do you prefer a sweet or savory breakfast?
My name is Diana Souza, and I probably prefer a savory breakfast.
Okay.
I'm here because I'm a college teacher and have low income, and I'm interested in trading off my very expensive insurance policy for an affordable care act policy. But I'm having trouble understanding some of the components of it, and so that's why.
Okay, Diana, thank you. And Diana did a really great thing, so if you could tell us why you're here, that'll add to the icebreaker part.
All right,
Curtis.
Oh, me? Oh, I'm sorry. My name is Curtis Brown, and I'm a retiree, and I am Brianna Brown's father, and I came with her today specifically because of the weather, so.
So you're a better driver than she is? Is that what you're
Well,
saying?
she's driving, but I'm watching.
Actually, not. You tell them too what it is. Today's my birthday.
All right. Today is-
Thank you very much. So after this, we're going to go have birthday dinner.
Exactly, yeah. I can also say that it is her 33rd birthday.
I'm thankful
I would have
for.
thought 23.
I would have thought 20.
I'm grateful for every year. I know that I promised.
Well, we hope you come back, Mr. Brown.
Thank you very much. Thank you very much.
My name's Christy Lara, and I've been associated with Deborah and Move On for a few years now, which is crazy to say in Dallas. My favorite breakfast is coffee, I should say.
Okay.
And
Good. Thank you. Christy. Okay.
I'm John McClellan, and I'm here because I want to do something, We all have opinions, and we all get frustrated and complain, And then it's time to do something. It's time to get involved. It's time to get informed. And so that's why I'm here.
Thank you, John.
I'm Liz Wally, and a savory breakfast would be my choice. And
Okay.
I'm with Clean Elections Texas, which is public funding for elections, as well as working with all the other organizations working with money in politics. And I've been a Move On member and House Party person since about '04.
Thank you, Liz. John, we don't know if you like a sweet or savory breakfast.
Oh,
Which one you like more?
Yeah. Maybe on the sweet side.
Sweet side? Oh,
Yeah.
okay.
I'm here in contrast to Deborah and Liz. I'm with Stay Put and Dirty Elections.
Way to go.
And I'm just picking up clues.
Okay, what's your name?
Paul Heller.
Paul Heller. Thank you. And what do you like? Sweet, savory breakfast?
You know, I try to skip breakfast and eat only after dark.
Don't turn everything on its head. I appreciate that.
Breakfast time is for sleeping.
Nice. William.
William, oh, perfect. I'm a sweet person. I got my fingers, a large spoon in the sweet, with the sweetener jar. And we're also the group that videotapes your bologna.
Oh,
Same crew.
okay. Nice. Nice.
I'm Burl Smith, and I like a savory breakfast. I've been trying to sign on for healthcare, and I've had multiple problems. I'm trying to do it online, and I'm trying to phone in, and I can't seem to get past, a certain point that, it's, their system is crashing, or I try to go online and it's not available, it's like, impossible task.
Mhm. Okay. Hopefully we'll have some answers, some resources. Burl, that's a good point, a good place to put this pin real quick. So I had promised Deborah to bring a navigator with me, the folks who help people enroll, especially for people like you that are, experiencing difficulty, and they couldn't come because of the weather. I just found that out en route here. But I certainly will make a commitment to you to get you hooked up with a resource, and Diana also, and whoever else has, specific questions about enrolling, to make sure that happens. Okay? And in the back.
My name is
Yes, ma'am.
Carolyn Geiger, and I take any kind of food for breakfast, doesn't matter.
Okay.
I am interested in the affordable health care. I do income taxes, and so I like to tell all of the clients to be
Mhm.
sure and sign up. And I got my daughter to sign up, and she said the insurance that she saw, that she had to sign up for, the deductible was $5,000, and there is no way a person with no money can pay $5,000.
Yeah.
So I need to know more before I be telling people to sign up.
Mm-hmm.
Yeah, actually, Lawrence O'Donnell, all of you watch MSNBC, did have somebody come on, a younger person that had just that same scenario, and Lawrence, who was a self-proclaimed socialist, I mean, he's very much so, he said, this is a good argument, this is a problem.
Mm-hmm.
So that's a good point. I'd be interested to know if there's any good answer to that.
Yes, ma'am. Yes. Oh, we're introducing ourselves. I'm sorry.
Oh.
I introduced myself. My name is Brianna. I'll be presenting today.
Okay.
I'm with the Texas Organizing Project. So you're just saying your name and why you're here. Thanks to Diana. And if you prefer a sweet or savory breakfast.
I'm sorry.
Yeah. I know the last question throws you up. And the last part is if you prefer a sweet or savory breakfast.
Okay.
It's an icebreaker.
Okay,
One of those things we like to do to
Confuser.
Okay.
get to know you a little bit
Just put
better.
you on guard.
Yeah, first of all, I apologize for being late. I just got the times confused, but anyway, my name is Gwen Graves. I'm a nurse, as well as, I just passed my exam for professional counseling.
You read
and,
LPC?
LPC.
That was my mom. My mom was LPC.
Okay.
Yeah. Congratulations.
Thank you very much. And I'm here because of what this young lady talked about and the gaps that have been left open that are being exploited by the right wing with insurance companies that have always provided insurance to their employees, and now some of them are giving employees stipends to go out and find their own health care insurance, to find that the premiums are too high, the deductibles are too high, you know, and they're getting off I mean, that's a good deal for them, especially if they've always provided it, and now they don't have to anymore. And then also, I'm here personally. I have a sister that's ill, and she's caught in that gap. She's worked 20 years, you know, making minimum wage on 2 jobs, never missing days or whatever, paid her taxes, and now finds herself ill where she can't work and she doesn't qualify for services because she's single, no children. And she's caught in that gap where when you put in your information, you know, and I don't know, I'm kind of suspicious about things. You put in all your demographic information, you put in all your conditions, and then they give you a couple of insurance companies that you can pick from. You don't have a big selection. And then what you pick from, you have these high deductibles, and by the time, and not only the high deductibles, but the high premiums. And she's asking me, well, what do I do? And I've gone through and put in our information, and if you put in a 0 income, I mean, the ACA, you gotta have an income. You know, and if you don't have an income, you don't qualify for anything. And we put in some numbers, low numbers, it comes back $10,000 as a deductible. And by the time, I said, you have to be hospitalized 3 or 4 times before you're going to be able to access your benefits. And not only that, I was a public health nurse nearly 20 years, working with people that are working these low-end slave wages jobs. These folks can't qualify for anything. It's not affordable. You know, and I don't think that legislation was meant to work alone. It was meant to work with also the businesses, that they would continue to do what they were doing, and also Medicaid expansion, which Texas is not going to participate in.
I guess I don't have to give my presentation anymore, do I?
Oh, I'm sorry. I'm so sorry.
I can just sit here
You
now.
know, I'm just so.
No, you don't have to apologize.
No,
but
I am.
you're
I'm
on
just
it.
so. But you know, I live alone, so I don't have anybody to talk to.
Okay.
So I come to places
come
to
here.
talk to folks.
Yeah.
You know, so you know, sometimes I just have to, you know, take a breath. I'm
Yeah.
a little ADD,
No.
and that's okay. So you do
No,
your
no, you're
presentation.
along with the best of us. I say that to say that, you know, this issue is very personal. You know, it is very high stakes, right? It literally is, and it's funny because I've given a couple presentations at some junior colleges, and I try to make it really like, so let's learn together.
Yeah.
And so I talk about like life expectancy, and in the United States, as is everywhere else really, like your life expectancy, one of the factors that will determine how long you live is your access to good quality health care, right? And in the States, does anyone read Alternet here? Okay, so they just had an article, and they were comparing McDowell County in West Virginia, which is a pretty, basically like economically depressed area, to like some county like right outside of like, I want to say Prince George, or some like affluent county like right outside of DC. And the only thing that they were holding for is, you know, economics and folks' access to healthcare and life expectancy in those 2 places. So life expectancy, I'm gonna say Fairfax County, I think that's the county was in Maryland somewhere, was 82, 82 as an average for both women and men. Anyone have an idea of like what it was in McDowell County, West Virginia?
56.
Huh?
56.
Yeah, it was 62, right? It was on par with Haiti, Guatemala, yeah? Countries that, I mean, they're not industrial, you know, these industrialized meccas that the United States is. So I hear you, is what I'm saying. This issue is very personal, and it has to do with how we experience our life. So You're not, please don't apologize.
Okay, I won't.
Okay.
Thank you for giving me permission, because I
Oh,
always
yeah.
find myself having to apologize
Don't
at
apologize,
meetings,
yeah.
okay? But, I'm sorry.
Okay, no, are you,
No, it's, the only thing, and I'm sure you're gonna get into this.
I hope.
This is, we have never invested in prevention, let's just be perfectly honest. We
Yeah.
have never invested in prevention, because if we have, there are certain diseases that would not occur. And then also, we believe that because we immunize, that diseases like measles, diphtheria, and stuff like that are eradicated. They are not eradicated. You've never seen a baby with diphtheria. You never want to see a baby with diphtheria. You never want to see a measles outbreak. It ain't pretty. And the thing of it is that when you're saying that people are not, and you're going to put these folks on the local systems to be able to get their care, it just ain't gonna be happening. And we know that disease doesn't care what social class you're in, what your age is, or whatever. We're going to see more disease, and we're going to see more debilitating disease. My sister's a diabetic. She's on so many medications, it's not even funny. She's 45. Her life expectancy is not very long if she doesn't have access to health care, and she doesn't have access to medication. If one medication costs $500 out of pocket a month, then she's going, as a family, we're pooling together, but that's only gonna last for so long. We're just regular folk. We're not in that 1%. So it is personal.
Yes.
So I'm sorry, that's all I have to say.
Don't apologize.
For now.
Okay. Hopefully we'll be hearing more from you, Glenn.
Yeah.
Okay.
My name is Robert Beltran, and Deborah's my wife, and so I support her the best way I can, when I can. And I want to ask Mr. Brown, either someone gave him that shirt, or he's a real fan. What shirt you got on?
Actually, my nephew used to coach for them.
Okay.
So, that's
It's
how
not
it's
actually
right.
Buffalo Bills. Cause the Cowboys. I'm just now seeing the Cowboys. Oh, the Cowboys, old Cowboy outfit. Okay. And do you like sweet or savory breakfast? What do you prefer?
I prefer healthy breakfast.
Healthy?
Savory is okay.
Healthy savory. Okay. Your egg whites in there.
Deborah Beltran, I'm an organizer with Move On, of course, but I also, on this particular issue, is very personal to me. I retired from Parkwood Hospital after 30 years, so I've seen the good, the bad, the ugly on healthcare, all right there at that one little place. So, I've seen women that have come in with breast cancer where the cancer is actually eaten to the surface of the breast, because she didn't have health care and she was scared. So it's a personal issue for me for that reason. Plus I have a daughter that works in an industry that does not provide health care, which, in my book that's a sin almost. It's really bad. The way our system here in this country is organized, it's all around providing health care through employment.
It used to be.
It's bad.
And then, something that's particularly bad when it comes to Texas, Texas leads the nation in a lot of pretty bad ways, especially when it comes to this healthcare question. So we have the most people who are uninsured in the state of Texas than anywhere in the country. So we're 6.3 million strong that way. But then also, Texas also leads in this other category, which is just because you have a job does not mean that you're going to have insurance. That is we lead the nation also in folks that have jobs and don't have job-based insurance, which contributes again to that big 6.3 million people that are uninsured.
I wanna speak on Dallas, since this is where I've been all my life. Listening to some of the situations and things, and I understand what Ms. Deborah is saying about people being afraid, but I've been here long enough, and I've been in the insurance. I was raised poor, okay? And I live in a poor area, and Parkland was my hospital. I have never been turned down from Parkland until I got old enough to get my own insurance, and they said, no way. But before then, all of my children were born in Parkland. We stayed 2 weeks. We didn't go home after the day after we had the baby. We stayed 2 weeks, and we got all the care. We got medicine we didn't have to pay for. They made sure we had iron pills as we were coming up pregnant. I never had all of these different problems that some people are having, because I went to Parkland when I got sick. You know, I had it dead head over there. So I have a problem. I wanted to hold up that it is there. It was there back in the day, before some president got in there and got in with the insurance companies and made them start raising the insurance. Before, when I did get a job, my job provided insurance for $100 a month for the family. And when I went to, if I felt like I wanted to go to the hospital and lay up for 2 weeks, the doctor wrote the thing. I went to the hospital, laid up 2 weeks, looked at TV, and ate their food. When I got home, the insurance company sent me a check. They paid the bill and sent me a check. So some of these problems that people are having, I did not have. So I have a problem. That's why I'm always on my kids. Look, let's get taken care of. Don't wait. You're talking about prevention. I like prevention.
Right.
As soon as your throat starts hurting, you go get some cough syrup. Let's take care of it. Let's not wait until you get to the point you start snorting and going on.
Yeah.
So I'm holding up for insurance before now.
Yeah, we're fortunate.
Yeah,
you can offer some testimony on.
Just so I'm not misunderstood, Parkland's a wonderful institution.
Yeah.
It has my heart always.
Yeah.
But the problem with Parkland is access, and they've done some of that as far as putting in their community clinics. But still, if you have a problem where you need special care, something other than like your regular doctor for a cold, if you need specialty care, it's hard to access, and it's hard to access because of volume.
Yeah, well,
So
mine
that's
did come
all I'm
before
gonna say.
all of this other stuff came in, so before we had too many people. My care was before then.
Yeah, I mean, I was a patient at
Yeah.
Parkland too, several times.
Yeah.
As an employee.
I just want to say that this touches me, particularly because I had a friend who was an occupier, and when you live with somebody on site in tent, even if it was for 3 weeks, you become very close. They're like your family. And his name was Fox, and or his occupied name was Fox. And last year, he passed away, and we didn't know anything was wrong with him. But he was 36 years old, and he was transient, and very nice guy, amazing artist. And it's because he didn't have regular care. It's not that he couldn't get care. It's that if you have diabetes, you need regular care. And because he was moving from couch to couch and home to home, he got left in that crack. And so you think in America, when a 36-year-old man dies from something that's completely treatable, and then you hear things like you don't realize, like, oh, you do have to pay for insulin. Like, my auntie had a refrigerator full of insulin.
Excuse me.
With bad, and the family had to come up with a month's worth of, which was over $500 to pay for, because the insurance wouldn't, even though it was an electrical outage, and it wasn't. And you think, is this what our country has come to? Is this what our nation has come to? And those are fairly, one extreme to the next. But on the other end, as far as, speaking of class and experience, damage to our health and our well-being have no class standing. I mean, it's interesting because as students, my husband and I were from the generation where you're a student for 10 years. And thank God there was socialism on campus, because we had the Student Health Care Center, and you paid $5 to go see the doctor, and it was usually a medical student or newly graduated medical student, and you paid $5 for any prescription you need. That was the standard prescription unless you needed to go see a specialist. And so we lived in that fake world. And then we jumped into a new world where we had a $5,000 deductible and we had a mortgage and a car payment. And so going to the doctor is a huge decision because you think, if I go to the doctor, I may not be able to pay my mortgage or my credit may go down. And if something happens in my family, I might not be able to help them. So I think speaking about this issue in the sense of class, but also real experiences in the extreme is important because we all have those stories of people affected and we all have those stories of people who have died. But I'm like, this gentleman next to me, what are we going to do about it?
Right.
And so I'm excited that TAC is attacking the issue, but I also know that the ACA is just the beginning.
Right.
And I know that in 06 and 08, we canvassed and organized for healthcare for all, healthcare not warfare. And you know, I always say when I sit in these groups, we have to keep our eye on the prize, that this is the beginning of the change. So.
I wanted to kind of tie in what both Carolyn and Christy were saying. And Deborah with her years of working at Parkland. So Parkland is one of our allies. We work with Parkland. County Judge Clancy Jenkins has been a real advocate on the ACA implementation here in Dallas County. We're fortunate because we live in Dallas County that we have some sort of healthcare floor. Because if we live, like folks in Collin County, Denton County, there's no countywide hospital system. And really, you know, we have a couple members that live out there who have diabetes. I'm thinking about one woman in particular. She went into the hospital for 4 days, and she had a $70,000 hospital bill. She had to declare bankruptcy. I mean, you know, that was the you know, the dominoes falling because she didn't have access to good health care, and she lived in a county that didn't have a countywide hospital system, right? We were just meeting with Judge Jenkins last week sometime, and he was going over the numbers. So we have in Dallas County about $1 billion budget, big budget, and $640 million of that $1 billion is spent at Parkland, spent taking care of folks. So that goes to Deborah's point of the sheer numbers, of the volume of people that we're trying to serve that way. Parkland has, I don't know if some folks, I don't know if it sounds like Carolyn, you might, that you're way back there. But Parkland has sent letters, because of the ACA, because of the Affordable Care Act, Parkland sent a letter to everyone who was on their Parkland Plus plan, saying that they had to go to the marketplace to see if they qualified, right? Because if they qualified for the marketplace, that made them they could no longer qualify for Parkland Plus, because by their estimates, about 20,000 people right now who receive Parkland Plus could receive health insurance through the marketplace. And the marketplace is, you know, that thing that opened up October 1st. I feel like I'm probably talking to, you know, folks that are really informed about this. That www.healthcare.gov. It also has a 1-800 number. And it is where you can go to get private insurance. Make no mistake about that. We were talking a little bit before that, you know, there is no public option. This is not socialized medicine. The estimates are by 2017 that $100 billion would have been funneled into private insurance companies. So this is really a boon for insurance companies.
Yes.
It really is.
Yes.
So, yeah, that's a lot. I wasn't working around this issue, but I remember the debates, right? You remember the debates, Paul. Folks on the left were like, what is this? What is this Heritage Foundation thing, right? What is this Romney Care that we are trying to institute nationwide? And that's a good point to make. I want to also say, like, as a Texas Organizing Project, since I'm being filmed, no. We want the Affordable Care Act to be as much of a success as it can be in Texas. So we're working towards that every day. And we have a realization, to Chrissy's point, that there's a lot about this that we would want to be different. And there's a lot that we're going to continue to fight for implementation of here in Texas, right? So we have that place, the marketplace that opened up October 1st. You go, you get private insurance. What I provided for y'all, that we call it a Count on Me. Some places I go, they call it a service document. But we like to know who we're speaking with. And then this is also a helpful tool for us to see kind of what you might qualify for. So at this point, we'll get kind of interactive, really interactive. Do people have that? Everyone have an account on me? Yeah. Let me get you. One reference. Okay, so this is not, I need to offer this disclaimer. I've been in front of some groups. We had our biggest workshop yet. We did it at the Islamic Center of Irving. We had like 154 people there. And everyone thought they were signing up for insurance with this, which they're not, right? So this is like an internal document. It was lots of excitement and everything. This is like our kind of like internal document, that we use to make our case about a couple things. But this chart here is based on the silver plan. So in the marketplace, there are 4 plans: bronze, silver, platinum, and gold. In Texas, that works out to 38 different options, different plans. And it's an estimate of how much you would, how much your portion would be. Okay, I'll do a hypothetical. I always like to say I'll play a little game of bingo. So if I were a family of two people who were uninsured in the household, and we made about $15,500 a month, or excuse me, a year, a month, I would be in the 1%. Yeah. Then I'd be looking at paying about $26 a month for health insurance on the silver plan. That's how that works. So anywhere along here that you see a number in a box, that means that you are eligible for the marketplace, right? You're eligible for the marketplace, and you're eligible for the government to pay part of your insurance premium. So that number that's in there is the amount that you would pay after the government has paid their portion. And you can get that back in a couple different ways. You can elect to have it as an individual deduction so every month you get like a check basically for whatever the subsidy is, or you can get it at the end of the year as a tax credit. Okay, so then you'll see, and this is going to what Gwen was talking
You say
about.
your monthly payment will be.
Yes, sir.
Could you explain what that means?
Okay, so your monthly insurance premium for your insurance would be the number that is in the box.
And you would owe that to a private insurer.
You would owe that to a private insurer.
And what would be the nature of the policy?
Oh, here's another disclaimer. So I don't work for an insurance company that way. I cannot give you I can't tell you, you can choose, those different plans. I can't say this in a general sense. So the gold, the bronze, the silver, the platinum have different deductibles, do you want dental insurance? Do you want, there are 10 basic DNA components of the ACA that all policies have to have. That's why a lot of people received letters in the mail saying that their insurance was no longer good. So those 10 essential things are, these things that we hear about all the time, like you cannot be denied for having a pre-existing condition. Hospital stays are now covered, maternity stays are covered, women can't be charged more than men. Folks, those young invincibles 19 to 26 can stay on their parents' health insurance until they become 26. So those are 10 essential provisions of the ACA that made some insurance policies that existed before illegal. I don't know, I've heard all sorts of estimates. I've heard anywhere from 500,000 to 5 million people got these letters in the mail that said that their insurance was no longer offered, and if they wanted a comparable insurance basically, then this was going to be the price, and it was $200 or $300 more than what they were paying. And that was to tackle this part about our healthcare system that exists where, maybe this is best illustrated this way. So the majority of people that file bankruptcy because they have medical debt have health insurance. It's just that their health insurance doesn't cover hospital stays. Or, they have what amounts to really junk insurance.
Let me come back to my question.
Yeah.
I have a family of 2.
Okay.
Uninsured people. My income is exactly $15,510.
Yes, sir.
I'm going to write a check to insurance company Y for $26. What does that buy me?
Right, I cannot tell you what that buys you.
But you can tell me how much it costs.
Well, I can give you an estimate of how much you and your family would be paying. I don't know what that, I cannot tell you, and unfortunately our navigator who was supposed to come, could have like really divvied up and told you like what that's why I was saying you're entitled to those 10 essential benefits, that's for sure, in this insurance. But what that looks like, what your deductible will be, I don't know.
So it
Yeah,
could be
it
$1,000 or $10,000.
Yes.
Well, the
Because it
deductible,
depends on the insurance company.
well, the most the deductible can be is $6,350 for all for the whole shebang, like this for the ACA, for the marketplace. That is the maximum. So I don't know how that works out individually.
But this could be for any, I mean, doesn't cover all the plans, and then it's 20.
This is only the silver plan.
Right.
This is the
I'm
medium
happy.
range plan.
I love the silver plan.
You love it. You want to sign up today?
All right.
Let me. I can add you to this because I made that commitment to make sure we had a navigator here. They're not here, and I can make sure they follow up with you to answer those really specific questions.
So so the different providers would vary how?
The different providers.
The
would vary
$26 is what it's gonna cost, and I would have the choice of more than one insurance company. And
Yeah,
they would
you-
have variations.
You would. So okay. So across those four. So we have those bronze, silver.
I
platinum.
love silver, I want silver.
No. Right. So I'm saying so, but even like, well, even within those,
Right,
there's only 38 plans
okay.
among those four options, right? So that I don't want to. I don't want to start negotiating from the corner like the president did to get the ACA passed
I
by
guess what
saying
I'm
that
looking
this
for
is this.
one specific example.
I have
Okay.
a specific
That's
example,
what I'm looking for.
and I think it was in the 10 that you listed. But one specific example that every healthcare plan, regardless of what tier you're on, is they will cover your annual exams, they will cover everything that is preventative, and they will cover all your annual workups. So your annual physicals. For well women, it's your pap smears. For men, it will be a colonoscopy after
Yep.
50. All of those preventative and wellness initiatives are all 100% covered no matter what plan you're on.
That's one of the 10 essential benefits of the. That's one of the 10 essential benefits of the ACA. That's my dad. We just went through his colonoscopy,
All
and it was free, and it was benign.
Yes, all preventative work is free. Your
It
annual
wasn't that
exams,
bad
your
either, was it,
wellness.
Mr. Brown?
It's free.
The colonoscopy we did.
No co-op.
Yeah.
No co-op.
Okay, I don't know, Paul. How's that? Is any of that sitting with you?
It's wonderful.
It's wonderful. You want to sign up today? No, I understand. I understand the need for like specificity because of how personal the issue is. I just don't. I know what I can and cannot tell you, and I don't want to direct you wrong. But I am certainly willing to make sure you get hooked up with a resource that can get you signed up.
I don't want, how does Medicare fit into this, for example?
Well,
It doesn't.
Medicare is great. Well, Medicare is great in this sense, I can tell you.
Yeah.
My dad's a Medicare recipient. So there have been some improvements to
Yeah.
Medicare
Right.
because of the ACA.
Right.
Prevention.
For instance, like those preventative things. So like the colonoscopy my dad just had, like that was covered at 100%. That donut hole that a lot of seniors get into, it's going to be closed or should be closed by 2015. So no longer will you have to pay X amount, basically a deductible for your prescription meds, and then you pay that and you get into a donut hole and you can't you got to pay through that deductible until you can get the insurance covered again or your medicines covered through the insurance again.
But is that just for seniors?
Yes, that is for people who are Medicare recipients. So some Medicare recipients are like
I'm a
dialysis patients
Medicare
that don't-
recipient,
Mhm.
and how they explained it to me is that because I am under 65, that donut hole will not close for me.
Oh.
It will only close for seniors. That's what was explained to me by the Medicare folks.
It only close for those 65 and older.
65 and older, and people that are considered, well, if you're on Medicare because of disability or whatever, that donut hole will still exist.
That hasn't been what I understood.
Okay, well,
And Medicare explained that to you?
Yeah, Medicare,
My understanding was that-
but I can call right now and then I can call in 15 minutes and I can be told two different things.
That
Because I
happens
do
to me.
that.
That's
Wait,
the reason
you know
I'm
what?
here today.
That happens to me all the time. Like sometimes I'm calling for my dad and I don't get the right answer. I
I
hang up and I call back and I'm telling you there's no consistent bureaucracy. That's bureaucracy for you. But
That's the
I don't know
reason
what
I'm
to
here
account for that.
today.
I'm saying like from the information that I have
Okay.
understood, that's not true.
Okay.
Because that covers like some, for instance, I'm telling all my dad's business, but he's also a dialysis patient.
Okay.
So like there's some dialysis patients that are under 65,
Right.
and so my understanding through that example has been like they're Renvilla and they're like their medicines would be covered under in that, or when the donut hole
is really
closes. That has been my understanding.
The donut hole is for those
Again, it's like one of
who
those.
purchase Part D insurance,
Yeah, Part D is the.
which is not part of Medicare, it's
Right.
add-on.
It's a different.
Yeah,
It is. You could either get that administered through an Advantage plan. I mean,
Right.
Or-
supplemental.
yeah, or through your supplemental. I mean, that gets.
But you have
That's
to-
how my dad gets it through his supplemental. But it gets a little more nuanced.
You do have to have, on Medicare, you've either gotta be in a supplemental program that has a pharmacy benefit, or you have to sign up for D.
Right.
And if you don't sign up, they'll put you in welfare, I think.
Right.
They'll sign you up for you, but, yeah.
There's a thing about, that I just found out about Medicare, is when you're a senior, is that if you make a certain income, you gotta pay part of your, supplemental anyway, but if you low income like me, you don't have to pay.
Right.
Yes.
And that's through the state. That's through like a QMB insurance, right? Through Medicaid, which is another one of you gave my presentation earlier when you talked about like Medicaid expansion. But one of the reasons why we have so many people who are uninsured is because of the way we administer Medicaid already in the state of Texas. So yeah, you could be entitled as a senior to for your premium to be paid $194, whatever for Medicare.
Whatever they take out.
Whatever it is, whatever they take out of your check, through the state.
Yeah,
Yeah, that's absolutely true.
yeah, but if you make a certain income,
You have
like
to.
another guy that was in my office, he had to pay it.
Yeah, and you could be like, well, and I get that, but you could be a couple dollars over, and
Mhm.
you still, have to
You
pay
gotta
that.
pay a monthly charge.
Exactly. Burl, did you have something?
No.
Okay. Okay. So you're not enrolling for insurance. This is a document that you fill it out. It helps us. It helps our cause, right? Yes, ma'am.
But if for Medicare, then I don't see how it can help.
Oh, well, you see, there's a box on there that says, "Are you insured?" Right?
Right.
We're gonna go through the whole thing because there's
Oh,
a couple
okay.
other questions they're really important to us on here.
All right.
Okay. So do you have health insurance? Yes or no? If you could, play a little bingo game, if you don't have health insurance, to get a sense of where you are. Yes, you want to sign up for the Affordable Care Act if you don't have health insurance, or maybe you're like Diana who has health insurance, but it's too expensive. And then those next questions for us are really important to that long-term piece that I was kind of talking about a little bit before in my introduction about who we are, the Texas Organizing Project. So this is so we have this healthcare campaign that we're doing right now, right? So, a couple years from now, whenever this is not so sexy anymore, we're gonna still be on the ground working. We're gonna still be on the ground signing up, speaking out about something. I can guarantee you that, because the communities that we serve, if they don't have health insurance, there's some other issues that are going on there too. So those are what those next questions go about. Liz, so I wanna know, do you plan to speak out? Right, y'all are already in this room, and I feel like y'all are already like organizers.
Well, I just wanna know, when do
Somehow.
I sign up? And
Okay.
when do I get to
I'll-
go to the meeting? And,
Okay, I'll tell you all that.
Do I get a little badge? I mean, it doesn't
You get a
matter.
t-shirt.
Okay, that's fine. Just
I
tell me
should've
what
put
to
that
do.
in. Okay, so that's the speak out part. Do you plan to be a part of this movement? Because we really are trying to create a movement. And then the next part is like, do you plan to vote? Or do you pledge to vote? We're just now, you're getting out of a primary season. Or the primary is on Tuesday. I was kind of just explaining before because of the C4 that we have, we can get pretty aggressive in our political message, right? And so as an organization, we endorsed some candidates this year. In Irving, we endorsed the candidate for House District 105, Susan Motley, who's running. And that is because whenever we talk about the Texas Organizing Project and like what we fundamentally do, really wanting to disrupt the cosmos. We realize a part of that is the electoral piece, and that eventually we don't want just a seat at the table. We want to be able to set the table ourselves. So we understand that it's really important that we mobilize folks to the polls. So in that House District 105 that we are aggressively, after I leave here, I'm gonna be phone banking for people to get to the polls on Tuesday. We do that because we understand that, government, all that, it's just a framework, and it's really important who has those seats, who's sitting in that chair. So that's why we ask you that question. Do you pledge to vote, right? Okay, so that's the entire, that's this entire thing. And this you so kindly return to me, and it helps what our eventual cause is, right? Which is never dying, incidentally, right? Organizations like this, Move On, will always be on the ground, always be working, and that's absolutely necessary that we do. Okay, I'm going to return to the other part. So, if you fall into this category here, this white category, not like literally white, but this category where there are no numbers, and that means you would qualify for Medicaid expansion, right? So that goes back to this, what we talked about, what Gwen was talking about when she was delivering my presentation, which is that there's a whole group of people in the state of Texas, 1.5 million of those 6.3 million people that are not entitled to the they're not entitled to the marketplace. And the way they're not entitled, so theoretically anyone can go to the marketplace and buy insurance, right? But like Chrissy was saying before, like for some people, it's going to be making a decision to buy this health insurance without any sort of government subsidy to help them, or keeping the lights on, or keeping food on the table, or keeping a roof over their heads, right? So this whole group of people, 1.5 million people in Texas, would have qualified for Medicaid expansion. We are really interested in those folks. We are really interested in creating a movement, right? Because this is exactly the way it happens. We got one man who makes a decision. Governor Perry makes a decision, and that decision, that one man makes a decision, and it affects all 26 million Texans, right? And kind of unapologetically so. So if that same person, and the numbers are, I mean, when I look at the numbers, it's always like, I get some chills because, across the nation, the marketplace was designed for people that are working or have some sort of income and can't afford insurance for whatever reason, right? But then there's a whole lot of people who are working and still cannot afford the marketplace, right? So across the nation, that's 400,000 cashiers, that's 400,000 cooks, that's 250,000 CNAs, nurses, aides, who are working and cannot afford the marketplace. So if any of those people, those cashiers, those nurses, aides, those cooks, lived in 27 other states besides Texas, they would be entitled to free health insurance, right? So and it's not all along real partisan lines. So we have some real conservative states, for instance, that have expanded their Medicaid. Just recently, or the one that most recently did it was Ohio. Governor Kasich, who is extraordinarily conservative there, and he did it in this way that we're really interested in seeing if we can model that, right? So it started in Cuyahoga County, which is the county that Cleveland is in, and I'm fond of that county because that's where I was for about a year working on the president's campaign. So they pat their county commissioner's court, similar to what we have headed by Clay Jenkins, said that they found some loophole, and they wanted to take what money would have been given to them through Medicaid expansion to ensure the folks there that would qualify for Medicaid expansion. So it started like that, and they got the money. Cuyahoga County got the money, right? And then it became this like Governor Kasich didn't have any way to bargain out of that because guess who likes when people are insured? When people are,
Hospitals.
Yeah, hospitals like when people are insured. These titans of industry like when people are insured. And they got into his ear and they were like, yeah, well, we need, people insured. We need a healthy workforce. We need, these things. And it's painted Governor Kasich in a corner, and he ended up accepting the money to expand Medicaid there throughout the state of Ohio. So we're really interested in that. We've been at the table talking about how Dallas County would do maybe the same thing, right? Who knows? We'll keep our fingers crossed.
What are the issues on that? Could Dallas County?
It's a big maybe. It's a big question mark. It's a big question mark. One, we need to get all the county commissioners to say yes, right? So Clay Jenkins, like I said before, has been a really great advocate for this. But there is some resistance on the commissioner's court. We need to be able to turn out 1,000 people to commissioner court sessions, right? We need to be able to fill that. I don't know if y'all ever been to, they're in that the JFK building, the,
Yeah.
sixth museum.
That small place.
It was?
Small place.
Yeah, right, right. And then, I mean, we always, that's how organizers, like, that's how we always, like, that's a lot of times, like, how we think, right? Like, we try to, we figure out, well, how many people do we need to fill up this room?
Yeah.
Right? To make our point. So that's, I would love to see some of these faces in that room with us, you know, if we're able to, you know, get that along, nurture that along. So the Medicaid expansion is huge for us. It's a huge issue, along with the Medicaid expansion part. So if that's not able to happen, I was saying earlier too, and I'm sorry that I keep on saying this, but earlier I was mentioning that Winnie Davis came to our staff meeting and said that she would absolutely support Medicaid expansion with a swipe of the pen. But if that doesn't happen, we have Attorney General Greg Abbott on the other side. He has sued the federal government records 27 times to stop implementation of the ACA here in Texas. He has made the linchpin of his campaign defunding Obamacare. I don't know if I've been looking at, you know, it's primary season, so you see all the commercials. And it just seems like you have to be, I don't know what you have to be. You have to, you know, be against Obama and want to hunt in order to, like, win the Republican ticket. I don't know. It doesn't matter.
Crazy, I think we've gone.
Or,
Shooting immigrants helps too.
yeah. So he has been, so he is definitely a target that we have identified. 5 days before Christmas, it was a statewide coordinated action. We went down to Austin. They were trying to make it harder for navigators to become navigators. So going back to that kind of organizer math. There were 95 seats. We found out we had a team down in Austin. There were 95 seats. We figured out how many people we needed to get there. We took up 70 seats, right? And we got on record about why it's so important that people be able to speak to navigators, why it needs to be easy for a navigator to become a navigator. And it was really powerful because, like, anytime, like, you know, we had 3 people who spoke, 2 of our members and our organizing director, and we all stood. I still get, like, goosebumps because of that. Because everyone, you know, people applauded after that because it was like, well, we provided a counterpoint. Because without that, it'd just been this. Yes, they need to go through a lot more. They need a lot more credentialing. Basically, a lot more money would need to be spent for this individual to become a navigator, which a lot of times either the sponsoring organization doesn't have or the individual doesn't have in order to become one. So right after that, we went down to Abbott's campaign headquarters there in Austin. And it was right around Christmas, so we sang Christmas carols to the tune of all people, you know, we kind of switched up some lyrics about, like, how we all deserve access to good health care. We couldn't get up the elevator. They wouldn't let us up. They're very aggressive about the whole thing, actually. And we did some negotiating with one of his campaign workers. That is to say that we have a definite target. Abbott is definitely one of our targets. We see him as a roadblock to not only this, to full implementation of the ACA, but also to, even though it's a federal issue, it somehow makes its way into those commercials, right? Against, you know, undocumented folks, right? So we see him as a roadblock to, you know, what we're trying to do as an organization. So he is definitely a target of ours that we are working every day. Every day against. Yeah.
Does anybody in here know, I was reading an article that, Greg Abbott became paralyzed in 1982 or 84. And so my question is, how did he pay for those hospital bills? And is he on disability? Because
he became rich
is he
because
taking his check, but nobody else can get theirs?
Exactly. He sued. He became very, very rich, and then when he got to his position, he closed the loophole
Yeah.
where you can't sue and do the
Right.
same thing.
He's
he
all
did.
about tort reform now, right?
Oh, yes.
No, but another thing people don't realize is this tort reform thing. What it does is when you can't sue for somebody like that that's going to have a lifetime medical problems, and you can't get enough money to cover that. What it does is it causes that person to what? To have to, for the taxpayers to have to take care of that instead of the corporation or whatever to do that, so.
Or bad practitioners. I have been a recipient of bad care. I know healthcare, I know the system, I know what to do. I go for my preventive whatever. I go to a reasonable doctor, you know, who I'm gonna have a routine procedure that ended up almost costing me my life. And 8 surgeries within a 4-month period. And losing my livelihood, not being able to sue because there was not going to be a big payday because of all the limitations in tort reform. And we have discussions around access, we have discussions around gaps with people, you know, not being able to get health care, but we've still not had the dialogue about bad practitioners out there that are not doing their jobs or doing poor jobs where people are left dead or disabled. And I have 2 members of my family that was left dead by practitioners. And here I am, a practitioner, and I was left disabled. My sister was left disabled. And I just cannot believe that our luck is that damn bad.
Yeah, it can't be a coincidence, huh?
I don't think so. I don't think so. And I, you know, and hopefully, you know, we'll get to that point. Right now, we're trying to get everybody insured and get them to good practitioners and stuff like that. But we also need to have a dialogue. There are people practicing out there that don't need a license. And it's easier for a nurse to lose her license over something really silly than it is for a doctor who has repeated offenses documented to lose his license. I was literally in a doctor's office where the state came in and started taking things off the wall. And I kept thinking, well, I just came here, what is this? And I asked, and they said, well, we really can't discuss it. You know, this doctor will not be in practice. And I went and looked online up his license. 8 years of documentation. This man had a head injury, and he's treating people.
You know, I'm never surprised. I have heard I'm pretty sure, because we're very data driven, that's why we have like this cool thing. I'm pretty sure I can like be like, well, you know, I've spoken to this many people. The stories that I have heard around this healthcare issue are the most tragic, are the most inhumane stories I've heard in whatever my experiences have been. And it just goes, it goes back for me to that larger question, and that question that I think that the Affordable Care Act really does, it really kind of gets to, right? Is if government is a good way to solve these issues, to solve our problems. Like that's a fundamental question that the right, the left, the center, all sides are asking. And literally Texas is ground zero as an experiment in that. Because if it works in Texas, it can work anywhere. And folks are really afraid about that. They're really shaking in their boots that if this works in Texas, then, you know, there's nowhere else to hide. Like those 27 other states that have their own exchanges, that have their own marketplace, that expanded Medicaid, that, you know, okay, it can work in those like far off places or like wherever it is. Even, Arkansas was one of those states that expanded Medicaid and has their own exchange. Anyway, but Texas really is ground zero for these questions around is government a good option for solving these really, really critical problems that we have, like access to health care, like good practitioners, right?
Yeah, but they have to work in, you know, the government can't do everything. They have to work, and even with the ACA legislation, it was not, I don't think that it was done to be just a solitary entity that was to work alone and solve all the problems of health care. No. It was supposed to be where everybody was supposed to be working together. You know, the businesses saw the loopholes that, you know, were not put in, the safeguards that were not put in the ACA. They saw the loopholes and they exploited it. And not only that,
because I see a couple of people.
I'm sorry.
I want to make sure that no, that's okay. I just want to make sure that you leave that comment. Okay, great. Thank you, Liz, for coming. Get home safe. No worries.
Call me Liz.
Yeah.
I have a question.
Yes, ma'am.
Where it says you can choose your doctor, my question is, because of something stupid I saw, when you go to a doctor and you have your Affordable Care Act insurance, does he know that you got it from the marketplace versus you got it through your employer?
My understanding is that it is no.
I wouldn't think so.
It's not, it's kinda like if you buy your ticket on Expedia, does American Airlines, will they treat you
Yeah.
differently because you bought it on Expedia versus other? My understanding is that it's not, like, we've had some folks who have signed up, they, you know, to go to the doctor, they've chosen a doctor. Now, there is a question though of, just like Medicare, like my doctor that I go to, you know, everyone doesn't accept whoever insurance.
Yeah.
Yeah, so, I mean, there's
Just like
that,
private.
I mean, just like,
Well,
But
and
no,
a lot
this
of
came
doctors
from
are
a-
putting out
a-
things that say,
Yeah,
you know,
sure.
we're not accepting this,
We're
this,
not
and that,
accepting
and this is just
Obamacare.
because of the ACA.
no, well,
But I don't think they can tell.
They can't tell
can't
because
tell.
it's a private insurance. It's not, there's, I go back to that, you know, there is no government option in this, which is, or there's a number I wanted to say. Oh, okay, just going back real quick to the Medicaid expansion. So it's 1.5 million across the state who would qualify for Medicaid expansion. Here in Dallas County, it's 133,000. We are, I mean, that 133,000 is of particular interest to us in our organization. And we're trying to come up with, okay, so if Medicaid doesn't get expanded for whatever, Greg Abbott, I think, yeah, that's where I took a turn. So Greg Abbott gets elected, if, you know, and, you know, he does this really aggressive march to you know, I don't know, implode everything. So what happens then? We are starting to ask ourselves those questions now. We are, you know, we have a healthcare campaign committee meeting every second Saturday. It's going to be this coming, it's in your, it's the 8th at our office, where we're talking about local solutions for folks who fall into the Medicaid gap. Are we advocating for more green space? So people can be out there walking in neighborhoods that only got green space to walk in, you know, so we can prevent some of these things. Is it that another part of the Affordable Care Act, it doubled the amount of money that is spent on community health clinics. So it went from $7 billion to $14 billion. There's also talk about, you know, Parkland getting some of that money and where that clinic is going to go. So we're hoping to get at the table with that discussion too. I mean, because that was another component of the ACA. So there are these other parts that were really, that deal with like the Medicaid gap folks that, again, it goes back to the larger fight, the fight that we will always be in, and, you know, and the need to, you know, have folks like join the movement and, you know, and really help us. Because it's with ideas and it's with folks with skin in the game too. You know, we want people leading the fight. They are uninsured. They don't have, right, so our whole, like our immigration campaign is led by undocumented folks, right?
Where did you get, where do y'all get the data for in terms of 133,000 people?
Health and Human Services.
Health and Human Services in Dallas County, okay.
Yes, ma'am?
I also have a question, this thought came to me, is that if we get more people covered with the Affordable Care Act health insurance, I mean, the possible result of that could actually be lower taxes in Dallas County that would normally go to Parkland Hospital to take care of indigent care. You're not gonna get rid of all indigent care, but,
Yeah.
I mean, that's another way we could actually lower our taxes, which if you look at your tax thing, Parkland's is way, way low.
Yeah.
Compared to DISD. So, I mean,
Yeah,
do you see that as a possibility?
We have not entertained that, but we need, I mean, that's why I love having like conversations like this, because, you know, we're trying to come at the issue from all different angles. You know, we're advocating for folks the more people who sign up in the marketplace, the lower those premiums will be, just by sheer, you know, like kind of economic math. The more who join, the less like our premiums will be. You know, that $640 million that the county right now spends on indigent care. Theoretically, if more people, you know, had insurance, then what if that meant that like the taxes could be lower all around? You know, that money could be paying for some other stuff, right? So we could maybe, you know, maybe our schools could improve, you know, maybe the money that we're the exorbitant money that we're spending on caring for, you know, folks that don't have any health insurance, you know, that it could be put into some other really needing like pockets here in Dallas County. But that argument about lowering taxes, we should be able to get some allies with that one.
I actually see it happening because
Yeah.
you've got populations that, they'll go to Parkland even if they have insurance, you know, because it's a generational thing. They've always, like the lady there, very high
But
things.
they have exceptional care.
Oh, they've got some centers of excellence, but you've also got a population of people that are gonna wind up there through trauma.
Mhm.
You know, it's a
Mhm.
a regional burn center, you
It's a
know,
regional trauma
a
center.
trauma thing.
Yeah.
It's got excellent, divisions of excellence there, the OB-GYN department.
Yes.
The busiest nursery in the country.
In the country.
But also one of the best, the NNICU. I mean, so I can see it happening, actually.
Yeah.
I see a
People
need
aren't gonna
for
quit
more
going.
community assessments
Yeah.
to be done so that you can have accurate data.
Mm.
You know, I mean, why aren't we looking, as we go through this ACA thing, can we look at prevention? When people have access and they're getting preventive care, going to their well visits and going to their preventive visits and stuff, how do you track that? And if you can track prevention, you know, that's a big deal, because if
Yeah.
you can track prevention, you can track the decrease of disease that is treatable.
Yeah.
You know.
Well, you know, some companies now, they incentivize people, like, you know, whatever company, I'm gonna just insert La Madeleine or whatever, you know, they might be working with their employees to get wellness checks and to, like, there are some incentives right now in some insurance policy, in some health insurances that are target just that, right? I don't know if they're like, I'm sure there's like empirical, there are numbers to like support it, but that prevention piece is huge. I mean, that's a big part of the ACA, in fact. It affects like Medicare recipients, it affects people who are signing up for health insurance for the first time, or, you know, through the ACA.
I worked with a company out in Frisco, a huge pharmaceutical company that, you know, one of the things they did for their employees, well, they could because they're never in a recession, insurance companies and pharmaceutical companies, but you got to go to some of the larger gyms, the major gyms
Right.
and stuff, and you got that for free.
Right.
That was part of your incentive packet.
Right.
And
Like
people
Senior,
utilize that.
senior sneakers.
Yeah, silver sneakers.
Silver sneakers, that's what it is. I couldn't remember.
Yeah.
Yes,
I think
hi.
some of the incentive programs, there are companies that offer, like $25 gift cards for each assessment that you take.
Right.
Back assessment, or if you go get your lab work done, that's another $50. And when you get your, you know, whatever they have set up for you to get those different tests, when you take those, you get those, dollars, or you get to pick a gift card or something like that, and your doctor actually sends that information in, so if they have that, and they track that information like that, so they have the information on you from year to year.
Yeah.
If you have high blood pressure, if it's improving, and what are you doing about it and all that. So,
Yes. Oh, what's your name, by the way?
Sharon.
Sharon. I'm Brianna. Nice to meet you too. William.
Yes.
And then Paul.
I'll be practice target number one for you, if you want, and this probably comes under good practitioners. All that stuff, you can talk about all these tests and whatnot, this gentleman would probably want. I do not. All I want is my medications renewed. Now, because I won't go through all these tests, my medication is now cut off. But it's okay for that. But I didn't need that cane until my medication was cut off. So how do we handle these factors? You know, that's part of the expression. That's medical.
I have an answer for that.
Oh, Sharon.
Yeah,
Great.
the
'Cause
insurance
you came in right in time.
Your insurance companies and your doctors are at risk to continue to give you medication without at some interval having some tests to see where you are.
I'm not, wasn't broken until.
Well, but the fact that you're on the medication, they can't just keep continually giving it to you without ever having any checks and balances.
I don't like doctors.
Mm.
Every doctor I've had
Must have been done.
has injured me.
Well, I mean, if you put yourself in the doctor's shoes and the insurance company's shoes, I mean, that's the only way they have to to know what they're doing.
I only have, my legal advice is I can only wait until I get a blood clot in my leg that breaks loose and gets to my heart or lungs, and then I can sue the living daylights out of them or deny the medication, which I was taking.
I don't know how that lawsuit would go over when they can't say that you
Well,
allow them
there's no
to
reason to
check.
cut it off.
Yeah, they can.
Yeah.
If you
Oh, I
don't
know
have
they can.
yourself
I know they
checked,
can.
if
Yeah.
you don't have yourself checked, they will.
But I don't plan to be abused.
Well,
Like I
see,
was.
that's a kind of leveled issue. I hear you're
Yeah.
concerned about being abused and stuff
Yeah.
like that, and having a fear, you know, of
No,
doctors and
doctors,
stuff
it's a
because of,
guarantee.
well, yeah, because of bad practitioners, but it's a level kind of situation because, you know, a doctor cannot just prescribe medication, just unlimited medication and not be able to assess your condition. That is considered malpractice.
Yeah, that in itself.
I've been on the same medication for 20 years.
That's why they have to check to see
Some
what's going on
medications,
and
you have
changes.
to monitor blood work.
You gotta monitor it.
Brianna,
Whoa,
where-
one second, Paul.
Yeah, that's,
Paul was, it was
Having-
William and then Paul and then John.
Having the county step in for the Medicaid expansion when the state didn't.
Yeah.
How can I learn more about that? And
Mm-hmm.
I thought it required some action by the state to make that permissible.
Yeah,
And
we're
it wasn't
researching that
simply-
right now. Like our policy, we're researching that right now to see like how that can happen here in Dallas County. One of the best things is a plug for the Texas Organized Project. Get involved. We have our monthly campaign committee meeting every second Saturday, and that's one of the things that we're really exploring. Parkland is also right now talking about paying the premiums for some of the Parkland Plus recipients now. That's also through the county. So it'd be, we understand that it would be through the county that that's done. And there was some little like loophole in the ACA that might allow for that.
well, also the way Texas is structured, it's kind of crazy. I mean, it's crazy enough, it's the reason why each state had to set up their own exchanges because, you know, insurance companies that operate in one state don't always operate here. And then in Texas, it's even crazier because we break it down by county.
Yeah.
You know, so, you know, there's insurance companies that operate in Dallas County that don't operate in Wise County or you know, any other county.
Or it can
So
get-
it just gets
Hold on, let me
crazy,
get
so
Paul real
that
quick.
might be
Oh, wait, so.
that might be the key, is because
County.
we're kind of county by county by county.
254
And we might be able to step out of what,
Yeah,
you know, Perry says and apply for our own.
yeah, Paul. I mean, I'm sorry, John.
John, I'm sorry.
I've got another commitment, but I was just wondering, where are we in the agenda and what's
Well-
the takeaway?
Oh, so you should
I
ask.
got this, that's a takeaway.
No,
for
that's
you.
mine.
I know, that's.
I can give that to you. Or will
That's
you
mine.
take? You can literally take that other portion. You can take with you. That has all my contact information
Okay.
on it. The takeaway is a couple of things. One, the agenda got blown a long time ago, thanks to you, really. You know, whenever you were like, "Oh, Brown, will you introduce yourself?" Oh, and I think I really like that about like this organizing job, right? So. I mean, this has really turned into a conversation. I think I've really like hit the high notes, but for us, I'll go back and say that we want the Affordable Care Act to be as much of a success here in Texas as possible. We're working on the ground every day to make sure that's happening. We're hosting these workshops throughout Dallas County to get people signed up and enrolled. We have our final push before the March 31st deadline is March 22nd. We'd love for you to come to that and bring some uninsured folks with you or bring people. Goes back to also that idea that, you know, there are power in numbers that we were talking about before. And always in what we do, like we want to turnout is important for us, right? Because we always want to send the message that there are people in Texas, Texans who care about this. And are not.
Yeah, so
backing
that's
down.
what I was wondering. What does speak out mean? And,
Yeah.
And I think what you're saying is, be informed, make yourself available, just show up.
Yeah, well, yeah, that's one. So the essence of like organizing what Deborah does, amazingly and brilliantly. So for us, it boils down some really concrete things. Showing up, 90% of the battle,
Yeah, that's
right? and for this final push, we're going to be doing phone banks. We're going to be doing canvases. And any really and idea coming to like that healthcare campaign committee meeting. If you look in that in the packet that I handed you, I was recycling because I thought you all could appreciate me recycling this group, right? So I didn't want to print out new ones. There's one event that's on there. It's the last event that is like within the packet. It's on March 8th, this coming Saturday, at our headquarters here in Dallas, which is on North Zane. If you could make it to that, that'd also be great. We can continue this conversation and continue like, yeah, maybe, you know, maybe there's some other allies we can reach out to, some people who want lower taxes. No, you know, like, maybe there's some strange bedfellows that can be made with this.
Yeah.
You know, people who want lower taxes.
Also, do y'all have can people sign up to get your newsletter? Don't y'all come out with an electronic?
Yeah.
Kind of a newsletter thing?
There is a newsletter we have, if you go to our website, Organized Texas, you can sign up for like the newsletter, and you get statewide information. We don't have like a Dallas County.
If I give you this information, what do I get?
Smile. No. That information helps us, right? If you're interested in speaking with the navigator, and it sounds like you are.
No, I'm not.
Oh, you're not. Oh, okay. Well, I was gonna say I can make
I want to
sure.
know more about what you do, and
Yeah. Well.
I have to show up a lot of places.
Thank you, Joe. Did you want to?
Well, you can do that in a couple ways, right? I can put you on my mailing list. Like I send out emails, probably twice a month. You know, letting folks know what's going on and some ways you can get involved. A lot of it has to do with like turnout. A lot of it has to do with like if you want to do some filming, if you want to do some canvassing, if you want to come riot with us as we often do. So that you could tell me that. I'll write that on the sheet and make sure that I get you signed up to my email listserv. Okay, thanks so much.
Thank you. It was a
Thank
pleasure
you.
to meet you. I look forward to seeing you.
Okay, it was great.
Thanks
So,
for all your good
do you
work.
think you could come on Saturday, next Saturday?
I'm actually leaving the country for a couple of weeks.
Okay, will you be back on March 22nd?
April the 1st I get back.
Oh, April 1st.
Yeah.
Okay, cool.
But,
So-
this is a first step.
Okay, I will, you'll be hearing from me.
Okay.
Especially because you check those two boxes, that means that you
And
really
when
give me
April
consent.
1st, I say, gee, it's a great thing, what do I do?
Gee, it's a great thing.
I sign up.
You want to sign up for,
It's April 1st, and I say, yeah, now I'm convinced, what do I do?
you want to sign up for the Affordable Care Act?
Yeah.
So April 1st, you're gonna
get
have
involved, I think is what he's talking
No,
about.
no.
For involved.
No, I want
for
to
the
sign up.
ACA? So, if you can sign up for the ACA, you'll be subject to the penalty if you would, oh, that's a good point.
So I'm forever screwed?
No,
Okay.
so open enrollment starts again November
You're gonna be
15th,
reported.
but you will be subject to that penalty.
So nothing can be done until November 15th?
Right,
In terms of
as far as
signing
the marketplace is concerned. But you will only be subject to that penalty if you qualify for the marketplace. So if you would have qualified for Medicaid expansion, you won't have to pay for the first year, it's $95 or 1% of your income, $47.50 for little people in your household. But it goes up, right? So the next year it's $325, next year it's $695, all to incentivize you actually signing up for healthcare or the marketplace if you qualify.
Okay, my issue was that I've already signed up.
Oh, great!
And I got information from Blue Cross Blue Shield, which I got in the mail. I'm no longer working, so the $200 and some odd dollars a month, I'm not exactly sure where they're expecting that to come from.
Oh.
And when I was going out there to sign up, it gave an amount of a credit that I could receive from the Affordable Health Care toward premiums. But
Right.
when I went through the process, it only allowed me to use half of it.
I don't know. I don't know.
Nobody down there does either.
Wait, down there, but I'm just trying to process all the information. So you're saying that you qualified for a government subsidy, and that in the end they only allowed you to use half
of it
of the government
that
subsidy.
premium would be.
So did that, and that made your current payments $200?
$200 and some odd dollars a month.
Okay, what would have made it? Like if you could have used like the entire amount, what could it have been? I'm just kind of curious.
100 and something.
100 something.
A little over $100.
I've not heard of that. I'm just kind of, Deborah had her hand up, she might be able to help with that. Did you know?
I would just say, if I was going through this process, what I would do is I would wanna sit down with somebody,
I know.
and not just do it on the computer. So what I would suggest is that,
Well, I thought that's what they were gonna be doing.
Yeah, give me your
Well,
information. We had
well,
a
we were
navigator.
gonna set up appointments
Yeah.
to do that.
I'm sorry, a navigator was supposed to be here, but because of weather, they couldn't come.
Yeah, that's what I'm concerned about, because I just got here, it's getting bad.
Oh, it is?
Yeah,
Yeah,
so
we
I
need
wanna
to-
go back so I can get over that bridge.
Oh, okay.
What I would do, where do you live?
I'm sorry.
I live here in Dallas, not too far.
Why don't you, no, literally, I made it.
North Dallas.
Okay, go to go to one of the Parkland
Yeah,
community clinics. What is the one right there on
Vickery
Live
on
Oak?
Meadow is
Vickery.
probably
There's
closest.
Park Lane,
Park
if
Lane
you're
what?
that far north,
Yeah.
there's, Live Oak. But what, if you go
Park
to one
Lane,
of the
Park Lane?
community clinics,
On Park Lane is Vickery, the Vickery Health
is it
Clinic.
Victory?
Oh, the
Vickery.
Health Clinic? Okay, I know where that is.
Yeah.
Where you can actually sit down with someone and hopefully you'll get a good person that can help you.
Yeah.
Get through the process.
Yep.
That's what I would suggest.
Yeah, well, Parkland has like the most navigators in Dallas County. They have like over 400 navigators, and they're at all these places. So
Yeah, because they want to sign up their patients, so.
yeah,
Are they available from person to person, or is it?
person to
online
person,
phone?
person
No,
to person.
no,
You actually
person to
go
person.
into Parkland, one of the clinics, and they'll sit down and meet
It's
with you.
part of their financial, you
I
go to
agree.
any part, if you go to Parkland, a community clinic, you're gonna sit down with somebody and do a financial interview. Because they wanna know where you fall, if you qualify for indigent care or, sign you up for one of the
Sharon, would you
Parkland
mind
Plus
doing one of
plans
these?
that's actually kind of a sliding scale thing. Or Medicaid, they sign you up for Medicaid, I mean, there's all kinds of things.
Oh, right.
That's what I would
Parkland,
suggest.
Parkland is good for that.
Is there anything happening in our state, Brianna, where like this Parkland Hospital is suing the state of Texas or suing, can somebody personally sue Rick Perry?
That's interesting.
That's a good idea.
Because he's costing the
That's
hospital
interesting.
and people money.
Yeah, he is.
I don't know. My opinion.
I have a Saturday engagement, but the Saturday meeting sounds exciting.
Yeah.
It is something I'm passionate about. I know it is snowing outside. I do want to say before we leave, and I apologize, but today in the Dallas Morning News, there was an article that there is a group, a PAC, a political PAC, that's been working in the shadows of ISD, and they are working on privatizing our school district. Of course, that's not how they're selling it to the people, but it will be the first open effort, I think, in the nation, where it will be a free-for-all. The schools will be on the market to the lowest bidder. So I encourage all of us, as we learn more about that, to read up on it. I imagine this happening to our schools,
Yeah.
where people are really,
Part of that globalization thing, isn't it?
yeah, where
The
people
corporations.
Oh, thank you.
are struggling, and then, for those of you that don't know, I put my hand in the hat, my name in the hat, to run for the school board, but this creates a whole nother fight on our hands as far as the privatization efforts. And it's being led by a former Enron executive,
Oh, God.
and some Wall Street hedge fund managers, and they know that Texas is ripe for this sort of thing. So, God willing, we can educate our community, about what that will inter. And as all of us know, on Tuesday, they're organizing signatures at the primary locations. They need 25,000 signatures to get this on the ballot for November. And if it's approved, then we will be open market. It'll be gameplay
Now, this
get
push
what on
to
the ballot?
privatize public
to privatize this.
entities is sinister as far as
It
I'm
is.
concerned.
Yeah.
Because what's happening, if you look at DISD anyway, probably, what, 75% minority children? So what does that tell you? Rich people don't need public education.
right.
And it's a drain on what they think their taxes. You know, it is something they don't need, and they don't care if we don't have it. You know, they don't care about us.
Because it's not affecting them.
That
So
and-
they're sending their kids to private schools anyway.
And for business people too, each child's head is worth $8,700. So that's like a gold mine when we think that it's a small economy. Our public school system, you know, is over $1.5 billion. So they're thinking, how do I get a cut of that?
Exactly.
These people don't know what's going on, and you know.
That's the thing, that people need to be pushed so hard to go and vote and pay attention to what's going on, and then when something like that happens, they're like, oh, what happened? It's like, what did you
But
vote?
we also need to speak in people's language, because what happens is
I
that,
bet you they don't know.
yeah, they, just like they're doing it kind of behind the scenes, you know, when you feed people inaccurate information, even people that would probably think that that wasn't a good idea, when you're starting to give inaccurate information and stuff like that, you're polarizing folks and stuff. You know, most people I know don't know how to speak that kind of language and stuff the way that they're doing it.
Oh, no,
It
and
sounds grand.
It sounds
like a grand
beautiful.
idea.
Support our public schools.
And your kid gets to go to a private
That's the
school
way
and everything is
that's always
wonderful.
the Republican spin. You know, if you, yeah, but this whole thing about this is a way to take taxpayer money and feed it to corporations. So it's about that corporate takeover of our government and basically our society.
And then you have so many people who are uninformed that actually go for stuff against their own interests.
Yes.
Exactly.
Well, and that's why TOP is so important. That's why, you know, having meetings like this, those of us that are in the community.
Yeah, we gotta get back to the old school way of doing things, and not just sitting in front of a television and
Well-
listening to what somebody's saying.
Well, too, you have to look at what's happened in our society. People having to work 2 jobs.
Right.
You know, I mean, it's such a struggle to make it, to feed your family these days. You just don't have the time, the energy to do that. Plus, again, I'm gonna get back to the, I know we're nonpartisan, Move On's nonpartisan too, but we've gotta get back to the fact that the Democrats need to grow a backbone,
Bam,
or
there it
whatever. And they need to
That's
get
my
the
favorite.
message out.
What
do you
is the
see
backbone
us-
if they have no balls?
Yeah, well,
That's where she was going.
whatever.
That's where she was going.
What do you hear? This political primary time, all you're hearing's Republican.
Right.
And when you
BS.
and when you're not hearing from Democrats, they're complicit.
Exactly.
In the problems that are going on and in the interest of Republicans when they are not speaking out and they are not speaking out in droves. And I am tired of this wave that has gone on for 20 years in Texas that nonpartisan, that they're not speaking out. We're not hearing anything. We're not hearing anything, and they're not
good about
outraged.
getting the message out.
I do want to say, speaking on this Affordable Care Act and debt, and, you know, I think you mentioned it's $200 and something a month. You know, the average American is $211,000 in debt. So the fact that they say, even if you know, if we look at $26 a month, or, you know, $200 a month, and some of the upper scale, $800 a month, if we don't fix the wage situation, not that I don't believe in fixing this as well, it really is, you know, it's set up for collapse. And if we don't start taxing the 1% like we need to, and we don't start educating our community about what's happening as far as wage deflation and inflation in the market, then, you know, it's just, I mean, this is the beast we're up against, and we know those that came before us beat the beast. So I don't fear that we can't do it, but we're right in the middle of it here in Dallas. So it's
And I don't believe that we can beat it dollar for dollar. It's going to take some physical labor.
No, it's
to
gonna
be
take
able
us
to do
walking.
it.
It's
That's
gonna take
exactly
us,
what
that's
I
what
mean.
TOP does, TOP walks.
It's gonna take more than that. You know what I advocate for is, as a senior citizen, and a retiree, I don't have to worry about looking for a job, right? So I can go to jail, and I challenge all senior citizens that don't have to worry, even if it's a misdemeanor charge, to worry about dragging around a misdemeanor charge. I mean, young people, we don't want young people to be saddled with this the rest of their life. So this is a thing for seniors. We don't have to worry about getting a job. So it's time for us to stand up and put our whatever,
Our values.
stand up and
Yeah, but she
go to
is.
jail.
But she is.
We need to go to jail, but I mean, talk about peaceful,
Yes, I know.
civil disobedience.
Yeah.
We're not gonna get anything. I've been in the streets for how many years? 2 years protesting and shaking my fist and doing this and that, and we haven't done anything.
So on
We
that
can't
note-
even get publicity most of the time.
Monday
So we've
at
got to
4
do
p.m.
civil disobedience, it's the only
Monday
way.
at 4 p.m. Our
places
infamous superintendent will be meeting at 4 p.m. They'll be discussing this issue at the school board. By discussing, they've already decided.
This Monday, so you're talking about tomorrow?
Tomorrow, they'll be discussing it, and we hope that the community comes out and we call them out on this measure and tell them we don't agree. You know, when you said fill the rooms, have been a long-standing activist, and Deborah knows that, but I've never had that perspective of filling the room.
Oh, yeah.
And God willing, people go down to the
Let's
school
see.
board and
Yeah.
fill the room.
We'll see what we can do to get some people there tomorrow.
And you know,
Do you know how many seats there are? How many people do I need?
Things are turning.
But yes, just look at that as an immediate concern in our community, and I'll give you guys my card if you're interested.
I would be really interested in
And,
your
Thank you all
Go
so
to the
much.
Dallas Morning News. It's not on their website, but it is on their print page today, and they do have a couple things on the DISD blog you can go to look at more information. I mean, this is all being just revealed yesterday.
Yesterday?
So we're learning, yes, because they're going to pay people to be at the polls to get those signatures.
Oh, sure.
They've already
I
had
was
this.
bombarded when I went to the polls the other day to vote. I always do the early vote. And of course, I go right there across the street from North Park Mall, that church there. I always go to say, and I was bombarded. Republicans vamped me when I walked up, and I thought, hey, thank you for.
Let's give our guest an opportunity to finish, and then I have an announcement. We need to do our homework. Do your homework. Do your homework.
Yeah, I mean, I think that's the best finish, right? This idea, I know Sharon, you weren't here before, but we're an organization that's about being in the streets. The way that I can think of all the ways, like just in the last 2 months that we've had members get arrested down in DC about protesting for comprehensive immigration reform. We went down to Austin. I mean, I always go back to this. The stakes are so high now.
Yeah.
They're so high. There are children. It's our lives. It's our livelihood. It's our ability to provide. The stakes are so high, so we need to be in the streets. I think earlier John was saying something about there's something he said, and it was like, well, yeah, if there was a revolution, then meetings like this wouldn't be taking place, right? Because the work would have already been. I mean, the work would have already been
We'd be in
done.
a basement somewhere.
That's what I'm saying. Like the work would have already been done, but there's so much work that needs to be done, and it starts in rooms like this. I mean, make no mistake about that. You can testify to that. You were saying, I mean, this is the tradition that you come from, and supporting organizations like Move On, like Top. I mean, it's part of the whole. It takes. Like I was saying before, Governor Perry can make a decision and affects literally one person makes a decision, it affects all 26 million.
Right.
But for me to get his attention, I can't go to his door by myself.
No.
I need to bring 5,000 of my friends with us, which is what we work on doing, right? Getting the publicity, making, like in the civil rights movement, it wasn't until the cameras caught the people, with water hoses and dogs, that it tapped into the other, right? It became an issue that wasn't on the margins anymore. So,
What I say, it's not only our privilege, it's our responsibility, to protest.
And our superintendent is paid more
than any
than
other
our
superintendent,
president.
yes.
Than the president of the United States. And why can't we have some doctors in our schools for those kids that need immediate health care?
Yeah.
Where a doctor would be part of DIS. I mean, I know they have psychiatrists,
But I mean, we need to rethink the way that we care for. If 90% of our children in our school district are in poverty, we need to think differently about how we provide them with an education. Because if they're not feeling well and they don't have access, maybe their moms work 2 jobs.
Right.
Maybe she can't take the day off to get them to the doctor. So we as a community need to start thinking of those ways to change that system. You know, I'm like, do we even need a superintendent? $400,000 could go a long way in DISD.
It can provide a
What
lot of
we- what
nurses,
we need
and
to
nurses
be-
would not have to have 2 and 3 schools to cover, you know, and the office aid people wouldn't be giving serious medication to children with serious conditions.
Yeah.
And it's going on because they don't have anybody.
DISD needs a very aggressive social work program
Mhm.
by division. They're already divided up into
And-
divisions,
and
and
I
they need
think-
a social work program that helps children and their families hook up with services.
And I
That's
do
what
want
they
to
need.
subclause this, that I just learned about this yesterday as it was the first article that came out, and, you know, we're all kind of in a buzz talking about it today, and tomorrow will be the first community meeting about this situation. But, you know, when I saw Enron and I saw hedge fund managers and I saw a secret shadow group, you know, we already have enough of that going on in Dallas, so to have more of that is frustrating. And quite frankly,
And it
makes me
goes,
really angry.
it goes back to like, just one of the points that you're making, like, when you talk about this being a responsibility, my grandmother used to always say, you know, when you know better, you have to do better.
Oh,
It
yeah.
makes us implicit.
My mom used to
You
say that.
Also, when you know, but like, that's where the responsibility really begins, right? And when we know better, we have to start doing better. And the doing is now, you know, the doing is today. It's gonna be every day after that, but, yeah, and just, sorry. That was well, the other point is like, all these things like you know, and like, the intersectionality of all this, right?
Yes.
Right? These issues are not, and because because class intersects with race, class intersects with race, all these things,
Healthcare.
right?
Mhm.
That fighting for a living wage, like Christine was
Yes.
saying before,
Yes.
right, might help be able to help you pay like an insurance premium, right? So it's about the action, it's about doing, and we can all do something. That's the great thing about it, right? Because we can all do something.
What I was gonna say is
Okay.
I'm a converted Catholic, but I'm a liberal Catholic. But there's part of the mass
So
that
is the
says,
Pope.
"Forgive me of my sins, those that I've done, for those things I have done, and for those things I have failed to do." So failing to do is as bad as doing something
Yeah.
bad.
How about the
So
sins
it's
you're
like your
going to be
grandmother.
doing?
Huh?
Never mind.
I want to say next month is Earth Day month, so our program next month will be on some aspect of the environment. And then after that, what I'm planning on doing, maybe we can work together, is doing a summer series on poverty issues that affect Dallas County and beyond.
Yeah.
Zachary Thompson, who's
Yeah.
Zach is a mentor of mine. He was my teacher, and he's the director of Dallas County Health and Human Services. So I've reached out to him, but I want to get Clay Jenkins and Parkland Hospital, and just let's talk about these poverty issues.
You know, the
that affect
mayor's
Dallas
on this
County.
kick now, like the anti-poverty mayor. He's forming a coalition, a task force to talk about poverty here in Dallas.
yeah?
Yeah.
This is William, your videographer from Two Hats Publishing. I hope you enjoyed this video. If you like it, please leave comments below, or like, or follow us and get notices of all our videos. When visiting La Madeline's restaurant, tell them you want to make your reservations to the next Move On speaker date. Space is limited, so make your reservations early. Call 214-521-0183.